back to breathing again. How many times do we breathe a minute? Okay, each cycle takes about 5 seconds. We'll eventually talk about, but it involves active inspiration and passive expiration, or inhalation, exhalation. This picture represents, this is just a lung. This is the lung, in lab you're going to learn the anatomy of this, so I'm not going to have to worry about covering that in here. But if this is one lung, these will, of course, will be the bronchi, correct? And at the end of that tree, which ends in respiratory bronchioles and alveolar sacs, at the end of the tree we have inside this space what's called the intrapulmonary space. That the purpose of the tree, that means big trachea, bronchi, primary, secondary, tertiary, bronchioles, terminal, respiratory. The purpose for that is to, of course, end up with enough surface area that you have plenty of opportunity for the gases to go into your blood. If you just had this could not possibly take care of the needs of such an intricate body. So you've got to have surface area, plus air has to have a chance to flow down. If at the end, if this went right directly into this, kind of like blowing into a balloon, if you have a lot of force, you could blow that balloon up, couldn't you? So you need to be able to take air and slow it down. Only way you can slow air down is to increase resistance and friction. That's the laws of physics. And so every time it has to go from a bigger tube to smaller tubes, it's confronted with resistance and friction. So it slows it down, and then while it is on its way then, it's being warmed up a bit, it's being cleared out a bit of dust and pollutants, because you have those cilia, don't you? On those, you have to review the package. You're going to have ciliated, pseudostratified columnar epithelium lining the trachea. So the cilia helps keep any junk that might be trying to get into that innocent little sac, makes it go up and out. It is polarized to outside your body. It doesn't move inward to make it accumulate in those sacs. So pay a little bit of attention to the kinds of histology, the differences between the trachea and the bronchial tube. So when you finish inspiring, all of these have become larger. And therefore, the pressure in there has been reduced, and the air goes whirling in. Okay? Now, if this is your lung, at the end of the last class, I said let's call this your rib cage. And your rib cage is adhering directly to the covering of the lung. And that makes the operative word is pleural. You've heard of pleurisy and things of that sort? Well, that would make this the visceral pleura, which was mentioned back in the first test. We did visceral and parietal pleura, visceral and parietal pericardium, and visceral and parietal peritoneum. That makes then the inside of your rib cage the parietal pleura. This is the cavity, the space, pleural cavities. Most people who know nothing, don't know a lot, will just simply think that inside the alveolar sacs is your pleural cavity, but it isn't. Just like in your heart, the chambers of your heart will not be the pericardial cavity. So, banish that from your thoughts if it ever got there. So this is called a potential space because these two adhere together. Each is watery serous membrane. And if you take two microscope slides and you get them wet and you put them together, you're not going to be able to pick them up like this and go phew, because they got all that pressure there. The only way is to kind of go like this and jimmy it apart. Well, that is what guarantees that this surface of the lung is going to go wherever your ribs go. So this goes out when you're inspiring to make the thoracic cavity bigger. Likewise, the diaphragm's going down to make everything bigger. And now the only time, and if you were to judge or put a number on what is the pressure in this space, it's going to be around 4 millimeters of mercury pressure less than what's in here or out here. Sometimes books will say 2 or 3. I'll just say 4. Okay? Now, there was something. One thing that you're going to run into when you read the book is that when you breathe, you are in various stages of breathing all the time. So sometimes you're in the beginning of inspiration, middle of inspiration, or you're beginning expiration, the end of expiration. Each time you progress from one step to another, a lot of these facts change, these numbers change. So it makes it difficult for beginning students. And so I say, most of you are not going to be respiratory therapists. So let's just talk about some numbers that will stay constant. And I don't expect you to say, if the intrapulmonary pressure is this, what's the pleural pressure going to be? I'm not going to do that. If I say, what is the pressure in the pleural cavity, you can rest assured by saying 4 millimeters of mercury pressure less than elsewhere. Got that? Okay. And we all know that for sure the air out here is weighing 760 millimeters of mercury pressure on the tip of your nose and your whole body. Those are constant. Okay, so when you inspired then, you've got, and let me put this as, this is going to be an alveolar sac. When you inspire, this is pulling this out. And the air that's coming in is pushing this way, isn't it? Isn't it? Those are the two forces that tends to make sure that the lung hangs on to the body rib cage so that the lung will not collapse. You don't want it to collapse. Otherwise, you have no surface for gas exchange. Well, so while you're inspiring, this is what makes it want to stay open. But once you start to expire, you're going to start putting a pressure this way, and to the point where it's possible, because this is serous-y, it's possible that this surface, if the air could get out so fast, that this surface would touch that surface, and in fact, collapse it, couldn't it? Well, if you are a mature person, and child, and infant, you will be making a special substance in here called surfactant. it's a detergent. So it keeps this from wanting, it keeps this from adhering to this. It's like a detergent works in water in the kitchen. So that it will not want to collapse. So what are the two forces that keep it? So it's going to be, one is going to be when you start to expire, the tissues naturally will recoil. If you've taken muscle and stretched it, elastic fibers, and you've stretched it, it's going to, when you stop sending that message, it's going to go, just like you pull out a rubber band. If you let go, it's going to recoil, isn't it? So recoiling is going to want to pull it away from the wall and make it collapse, and correct surfactant will keep it from collapsing or adhering here and collapsing. So these two features keep the lung open. Those two features keep it from collapsing. However, as long as these two equal these two, you have no problem maintaining your breathing rhythm. Premature babies don't make surfactant yet. That's why when they're born prematurely, those little sacs want to hang out together and collapse. So they have to put them on a respirator to encourage, to make sure that they aren't going to collapse. Now, until they start making surfactant. Now they give artificial substances if they suspect a baby is going to be premature to keep that from happening. But a number of years ago, before they ever knew it, that was one of the primary reasons why preemies died. And now they've worked through that, they understand what to do. So you want to make sure that these two forces and those two forces cancel one another out. Okay? Make sense? All right, so now what I'm going to do, by the way, if you're an ODS person, and this is, I'm serious, if you know somebody who's from an ODS who's not here, tell them that Monday at the end of class is the last time to take it. Anybody come on Tuesday? Sorry, you'll take the exam with the class. Yes. Well, if they cancel one another out, you're going to be able to not have your lungs collapse. Because there's a tendency when you snap back, it could close, make them touch one another, the membranes, and close it down. For example, let's say a person, give a stupid example, goes into a bad neighborhood, and there's somebody out there with an ice pick. It happens. Maybe not a nice pick, but maybe a knife, I don't care. But if the person manages, if somebody happens to stick an ice pick through the ribs, between those intercostal muscles through, and they go into this pleural space, what you don't want to do is pull it out. Because you got a hole here now. And it's 760 here, and it's 4 left here. Air will go whirling in, right? Pressure gradient. And that presses on your fluffy lungs. And before you know it, the lung will collapse. It can't handle the force. So they have to go now, put a little tube in here, pull that air out, and then plug the hole. in order for them to get their lung to reinflate. All based on air pressure. That's all there is to it. Anybody else? Okay, so now I'm going to draw a picture bringing the air into the lung, and then show blood getting to the tissues, etc. Keeping in mind that the heart is going to be in between these two pictures, which I'll point out a little later. So this is the picture that can count for both talking about oxygen or carbon dioxide, but I'm going to do it for oxygen first and alone so that the picture doesn't become too confusing.
Thank you.
And I'm not going to obviously try to do every kind of, primary, secondary, tertiary. I'm not going to do that. But I'm going to say that this is just a terminal bronchiole. And this is going to be, I'm going to say this one is going to be a respiratory. What's the difference between terminal and respiratory? For a point, raise your hand. I mentioned it in my last class.
The respiratory is where the alveolar sacs come.
No, well, that alveolar sacs come off of it, but that's not the difference between this and this. Yes.
The respiratory is where that
Yeah. And this is able to put some of the gases into your blood. Here, it's just coming in and going out. Okay. So now, at the end of here is going to be an alveolar sac enlarged. So the air is coming in like this. Right here now is going to be a capillary in the lung. This is all pulmonary circulation. Capillary. This is going to be the relationship between the blood and the air, called the respiratory membrane. And then over here, I'm going to show what's called microcirculation. So this is called microcirculation. This represents all of your capillary beds all over your body, everywhere, every time. Your cells are just a cell or two away from a capillary. So, 760 mmHg. That's how much pressure. So now we have to talk about air being a mixture of gases. And we should know, you should know, what is the most prevalent gas in air? No. Hands went down. You don't want to be heard? At first she said hydrogen. Whoop. Strike a match. Okay. Nitrogen, 78% is nitrogen. How much is oxygen?
21.
Good, see, somebody did it, we didn't even ask for a point. Aren't you sweet? 21%, that's at sea level in a room that hasn't been sat in by hundreds of bodies for a long time. And then the rest, which is 1%, is simply carbon dioxide that's being expelled, pollutants, water vapor, whatever. Maybe a few bacteria and viruses from somebody sneezing in your face. But now we have to figure out, according to the laws of physics, each gas in a mixture exerts the pressure as represented by how much of it is in that mixture. So if you wanted to find out what kind of pressure oxygen would exert here, it's going to be 21% of 760, which is going to be like about 159 mmHgs. And this is called the partial pressure of oxygen. P stands for partial pressure. I would assume you heard of partial pressure. So, no? Did you go, have you taken chemistry? Well, that's tough, honey. That's too bad. I'm sorry. I don't mean to be fat. I'm sorry to hear that. But even so, don't you ever listen to the weather? Or do you just go out in a thunderstorm and pray to God it doesn't hail on you or something? So partial pressure. Whenever you see a P, it means partial pressure. And so, right here at your nose, the pressure exerted against everything it touches is raising a column of mercury to 159 millimeters. That's what it is. It'll be less if you have 20%, correct? Etc. So anyway, when I make the rib cage go out and the diaphragm go down, I am creating a lower pressure here. So this air comes whirling in, all of it. It all gets down here. What would you expect the PO2 to be? Common sense. What do you expect it would be? Somehow when you bring in numbers, people just fall apart.
Can you repeat the question?
Okay, if you bring in a whiff of air in a room where the oxygen is 21%, what would you expect the amount of oxygen to be when it gets down here to the alveolar side? Huh? Common sense is how about 159? Isn't the purpose of respiration bring that air in? Does that make sense? However, there's a situation here in this. The epithelium here and the epithelium here is moist, isn't it? It's a kind of a mucous membrane. So sometimes some of those little oxygens get picked up by those cells, and the cell says, I'm going to steal this. And it uses it for itself. It doesn't put it in the blood, so it's not being used to help your big toe. It's being stolen by those cells. So that by the time that whiff of air gets there, enough oxygen's been taken away so that instead of being 159, it's going to be 104. This is just something you have to memorize. A constant to memorize, PO2, 159, 760. Those are numbers you've got to memorize, because those are going to be your constant numbers. Okay. Yes.
What does that say up the side?
Thoroughfare. I'm going to get to it. So, now, so far so good. This is when you are, did I hear no? Well then tell me what's wrong. Who said no? Okay, what don't you understand? You disappeared? Well, maybe I need to meet with you. Okay, I mean, but if other people are feeling the same way, I want to know. I want to know where I need to go back and clarify. How many of you feel hazy? Raise your hand. Okay, where do you want me to start? Under pressure? Like what's pressure? I'm sorry? Come again.
Partial pressure.
Okay. Gee, I get pump. Okay. Partial pressure. Yeah, and I guess it also, not only do you tack numbers to this, you tack the word physics. And anytime a person hears the word physics, they say, I'm going to shut down. That's why I don't use whose laws these are. Because if I threw that in too, you'd have thrown it out a long time ago. So, if you know that 760 is a method of determining pressure, and that it raises a column of mercury to 760 millimeters. Does that make sense? Okay, so, people need to know, though, not just that. They need to know how much pressure does each of the gases in that mixture have. The gases as a whole is 760. So what you do is say, well, what percent of this total 760 is oxygen? Got that? And it's 21%, isn't it, at sea level? Whereas nitrogen is 78%. I could talk about nitrogen, but you know why I don't? We don't use it. It doesn't pass the membrane, which I'll talk about separately. So if you want to talk about just the oxygen in a mixture, you say, well, let's talk about its partial pressure. That's what the P stands for in front of oxygen. And that means what is 21% of the total, which is 760, and that was 159, correct? Does that make sense? That means of all of that gas, 159 of it was due to oxygen. Okay? So, if the job of respiration is to take that air from out here and carry it undisturbed, unused, to the bottom or the end of the rope, or the trail, it should still be 159, shouldn't it? But we know that some of the oxygen is taken away by these lining cells and used for themselves, to the point that if you measured the PO2 now in here, instead of being 159, I'm telling you to know that it's 104. Now some days it could be 102. It could be 99. It just depends on how the cells scavengered. Yes.
The 104 is what you're sticking with for test purposes.
104 for test purposes is what I'm sticking with. Okay, so far now, does that help you a little bit? Anybody else? Any other questions? Yeah, oh, okay. So, now, this is the blood, and it's coming from your heart. Do you suppose this blood is as clean as it's going to be, or as dirty as it's going to be? So, you're going to send clean blood to the lungs to get cleaned up. It's dirty. It's dirty. It's come back from your cells, hasn't it? And the cells have given it the CO2 they made and other kinds of bad stuff. Okay, so I'm going to say that the PO2 inside this dirty blood is as low as it should be, can ever be. And that's going to be 40 mmHg. A fact you gotta remember. So the dirty blood, PO2, 40. Okay? Anybody?
Why did it lower?
Why is this lower?
Yeah, just,
Well, didn't you just drop a bunch of oxygen off at the cells to be used?
yeah,
So if it's gone, that's what made this lower, right?
yeah, but it cut drastically, so I was just wondering.
Well, because it's drastically going to be going out to the cells.
Okay.
The cells need it,
Okay,
okay? Yeah, and once the oxygen is taken out, it doesn't go back in because it's used. It's gone. But CO2 comes out, doesn't it? Okay, so now, if this blood is passing through this capillary, it takes it about 1 to 3 seconds to do this. In the meantime, if it's 104 here and it's 40 here, in which direction is oxygen going to go? From here to here. From more to left. Down is pressure gradient. Or pressure and concentration as well. Okay? So, instead of having enough time to be 104, by the time it exits here, the number you have to know is 101 mmHg. So from 159, it goes to 104, and from 40, it goes up to 101. These are just statements of fact, and you just have to know them. Any issues? Yes. The clean blood, the blood that's going to have a chance to get to your big toe, has this amount of oxygen in it. The PO2 is this. The PO2 when it's dirty is this. The PO2 in the lung is this. The PO2 out here is this. Okay. Now, so, that's going to go back to your heart, isn't it? To what part of your heart? The left atrium. Down to the left, out through the aorta, all over. Now we're getting to your big toe. It's never left an artery. Here is the arteriole, the end of the passageway. And the arteriole, you'll learn, is the workhorse vessel of the cardiovascular system. But when the blood gets here, what is the PO2 going to be? Oh, I heard that. 101, yeah, and nothing's happened. It's not gone into any capillary bed. So it's 101 mmHg. Well, now here is, and this a capillary bed has an arteriole, and it has, this is going to be a sphincter. It's just called a precapillary sphincter. Sphincter is a circular valve. And when it is open, the blood will flow like this into the capillaries. And in between all of these capillaries are your body's cells. And I'm going to put a cell right out here. And if you checked how much oxygen there is in a cell, a given cell, it's usually going to have a PO2 of 20 mmHg back. And if you tested the extracellular fluid here in between the cells, you would discover that that PO2 is about 40. These are just facts. This is in your big toe. You've been moving your big toe, let's say. So you have been using oxygen, haven't you? Like to move your toe? That means that more than likely your PO2 is going to be low, isn't it? And if you have a low PO2, what have you made a lot of? Gas. CO2. So your PCO2 is going to be higher. And if you're making a lot of PCO2, what might your acid environment be? More acidic. Carbonic acid. So you say that your pH is probably low. And if you've been undergoing metabolism, what about your temperature? Is it up or down? Okay, good. Higher temperature. That's why inside of you is so much hotter than close to the outside. Because metabolism gives off heat. That's what maintains your body temperature. So, this is what we call tissue needs. If these conditions exist, this capillary, this sphincter is going to be open so that the blood can pass through and get out. So eventually, what do you think for a point? What do you think this PO2 is going to be if the sphincter, somebody doesn't have a point? I thought you said sorry. No, I was saying sorry. 40, 40 what? Correct. PO2, 40 mmHgs. Yeah.
When you say just an individual cell has a partial pressure of 20,
Yes. That means that that's how much oxygen is in there. Now, once the oxygen is used, it creates CO2. So as that goes down, oxygen slips in. See what's happening here is, if this is 101 right here, and this is 40, oxygen leaves, doesn't it? And if this is 20, oxygen goes into the cell. The cell uses it.
oh, so you're talking about diffusion? Is it like diffusion out into the cell? I'm confused.
No,
I'm trying to correlate the 101 and the 20. I understand that.
okay, well, the amount of oxygen you have at the beginning of this capillary,
Okay,
101.
okay.
Right outside, now remember, the sphincter can be open or it can be closed.
Right.
if the sphincter is open, this is 101, and this is 40 usually, and this is 20.
What's 40?
The extracellular fluid around your cell.
Oh, that's it. Okay, I know.
Okay, good. Now, the sphincter may not be open because the cells may be fine. You have to know one thing for sure, and that is you never have, mark my words, even the sleepers back there. You never have blood in every capillary because you don't have enough liquid blood. You have too many capillaries. If you did do that, you would have no blood pressure and you would die. So, never will all of these sphincters be open. The reason why they open is tissue needs. If the temperature is not high, if the PO2 is not low, etc., that's when the sphincter stays closed. And the blood is able to go through like this, through a thoroughfare vessel, which is not a capillary. What would the PO2 be then if the sphincter were closed? 101. That's why this is 40 and not 0. For those of you who are thinking mathematically. Now, is this making sense? Yes.
So the tissue needs, whenever all of those conditions are being met, the sphincter
Is closed. It'll stay closed and the blood will just go psh, like this. And this 101 will mingle with 40. And eventually, by the time it gets back to the lung, it is 40.
And if those tissue needs are not being met, then the sphincter opens
Yes.
to create
To
conditions.
let the oxygen escape, go into the lung, go into the cell, and get used. And when it's used, it's gone, right? And instead comes CO2. Yes.
Can you clarify why when you go to the basic 40 and then?
Well, when it goes through the thoroughfare, well, it's not like you have only one thoroughfare. You've got a bajillion situations like this. Some are open, some are closed. And when all is said, you guys are restless in here today, it is not time to leave, please. Calm down. If you got a whole bunch of them at 40 and a bunch of them at 101, it ends up by the time all is counted and said and done, that when it gets back, it's around 40. Okay? Now, if this were the only story in town, that would be different. Then that question makes sense. Yes?
If the pressure in the PO2 and the arterial is 101, does that mean the gas exchange occurs in arterial?
No, 101 is what it was down here, correct? Yeah. It has no exchange at all. The only place you can exchange it is in the capillary. Okay? Anybody else? Capillary is the only place. Go to the thoroughfare, nothing happens. Yes?
I guess the picture kind of confuses me because it looks like the blood's going around the capillary.
See, here's the capillary.
Yeah. So what are the circular things?
Cells.
Okay.
Yeah. And in between, extracellular fluid. Okay. Anybody else? Yes. What's the PO2? The oxygen? The PO2? How about breathe in? That's what you're doing here. You're bringing the oxygen to here. And it's going into your blood. And you're getting it from out here. That's why you breathe. Does that make sense? Or was that not your question? Well, then tell me what your question is, louder. You don't want to? Anybody else? Come on after class. We're not finished. We've got 5 minutes. Now, pay attention. Once, and I'm going to just put that right here. Let's say that this is a capillary, and here is a cell. Oxygen went into it, and cellular respiration occurred. CO2 is made, and you have to know that CO2 is very, very soluble. Who knows what the number of carbon dioxide is?
2.5.
No, we're pretty close.
Oh, carbon dioxide?
Okay. The solubility of carbon dioxide is 20. Oxygen is 1. Nitrogen is 0.5. This is solubility in a membrane. So once CO2 is made by the cell, which you understand cellular respiration, it leaves immediately because it's so soluble. So the PCO2 is 0 in this cell. By the time you measure this extracellular fluid, it's going to be a PCO2 of 45 to 46. That's what it is. It's just a statement of fact, one of those things you gotta memorize. Now, back here, when the blood comes into the lung, is it dirty, right? Is the CO2 going to be higher or lower? So it's going to be a PCO2 of 45 to 46. Guess what? That's what it is over there. When it passes through here, you have to know that the PCO2 in here is 39 to 40. You have to just know that. So that when the blood comes through, if this is 45 and this is 39, what way is the CO2 going to go? Obviously out, correct? And so when it does so, if you check the PCO2 over here, it's going to be 40. These are statements of fact. Now, pay attention, please, because you've got the weekend to prepare. Your test is on Wednesday. I'm going to go over this part one more time, so you practice.